Hello and welcome back to a brand new podcast where we explore the world of health, wellness, and medical breakthrough. As you can see behind me, we're at Fortis Gurgaon, and our guest today is Dr. Naval Mendiratta. He's a rheumatologist. Hello, Dr. Naval, and welcome to our show. To kick off the episode, I would like to understand, or in simple terms, what is rheumatology?
Okay, thanks, man, for inviting. So, ideally, see, rheumatology is a very niche branch. That is, it has been coming up since last 15 to 20 years. So, a lot of people are still not aware about it.
Correct.
Not even the public, a lot of doctors are still not aware about it. Since last few years, they started gaining. There are rheumatologists also who deal with it.
Okay.
So now people always ask which are the rheumatologists, who are orthopedics, how are they different? So rheumatologists are specialized physicians. Like we say, physicians who have done medicine and then they practice in cardiology, gastroenterology, nephrology. The same way the rheumatologist also goes. So the rheumatologist basically deals with all your immune problems, like where your immune system is attacking against yourself. So now the difference between the orthopedicians and rheumatologists comes that orthopedicians are the specialized surgeons. If you want to go for a knee replacements, hip replacements, or any fractures, anything, so we first go to the orthopedicians only. But there are a lot of diseases like rheumatoid arthritis, lupus, where your immune system is active against you. And if you can reverse them with medicines, so they go back to their normal level without damaging the joints. So that is where the role of rheumatologist comes in play. So basically, they are specialized physicians who will control your disease and the pain with proper medications. So you don't end up in a joint damage and you don't end up in any disability for throughout your life.
So can we say that the main difference between an orthopedic and a rheumatologist is that the orthopedic doctors are also surgeons, whereas the rheumatologists are only for physicians and for internal medicines, to be precise?
Yeah. So now, if we go into the depth of it, so what exactly the rheumatologists deal with is like your immune system, which is meant to protect you. So somewhere that gets hampered either because of our genes, it gets triggered by some viruses, vaccines, or any other problem, and it starts attacking your own self.
Right. So why don't we take an example and talk with an example? Because while I was sitting and waiting for our turn to come, I saw there were different patients coming in, meeting you, starting from an old age lady. Then I think a boy came, and then a very young girl also came. So tell us, in terms of, or taking an example, how would you explain what rheumatology is?
Yes, that's a valid question. So a lot of times, like when I joined this hospital also, so always even the management was quite confused, which branch the rheumatology will fit in. They were like, you go and sit in the orthopedics department, it will be like a whole thing.
Oh, there was a confusion?
Yeah. So even the whole management. So I had to explain them because see, rheumatology, we have patients as young as 5-6 years old who can start to have the problems, and we have adults who go up to like 50, 55, 60 also, who can have the problems.
Sure.
So age is no bar in rheumatological diseases. So it basically somewhere the process has started. So quickly you catch it, the more you're able to reverse. The latest age we have seen yesterday, I had a patient at 80 years, she started developing the symptoms of arthritis, and till now she had been completely fine all throughout. And then we had this kid which you saw, she was 13, 14, and she's again suffering from rheumatological issues.
Okay.
So that's why the rheumatology issues have no bar. So a lot of people are confused, like we have a knee problem. So the osteoarthritis comes in. So we are at 55, 60. When the problem starts at 20, 25, they always say that we are at such young age. Why the problems have started. But just to get the facts right, most rheumatological problems starts at the age of 20 to 40 only. Females definitely have a more predilection towards the problem. A lot of it goes towards the estrogen they have, and that's why a lot of diseases of autoimmune are common more in females than the males.
So are you saying because they have more estrogen level, that's why they're more prone to?
That is one of the theories which has been prone to. And second, a lot of females go through a lot of changes, especially in pregnancies. So pregnancy itself sometimes acts as a barrier to start something which was always hidden underlying. So that's why the female's body goes through a lot of hormonal changes which men don't go through, and that is one reason they have a more subset of autoimmune problems than the men.
Okay, we'll dig deep into it more in a bit. But before that, can we quickly check what is your background? Where do you come from? What is your education?
I am basically graduated from Chennai, from Ramachandra Medical College, and I did my medicine in MD medicine from Pune. And then since then, I've been in rheumatology since 2011. I did my fellowship in Singapore in 2013.
Wow, that's great.
I was associated with Medanta Hospital for 5 years, and now I've been with Fortis since last 6 years now.
From last 6 years.
Yeah.
Okay, sure. So, again, coming back to rheumatology, I think it's still not very clear, especially to me, that, what exactly is the difference between an orthopedic and, the rheumatologist, barring that, they do surgery and you're more into internal medicine. But, what sort of patients do really come to you for treatment?
Okay. So basically, we try to tell the patients like there are two types of arthritis when we divide the terminologies. Okay. So what exactly is arthritis? First thing we need to understand that.
Correct.
So arthritis is just like a term like fever. So once you look into a fever, you try to see which cause of fever it is, whether it is a COVID, whether it is dengue, whether it's malaria, typhoid. The same way when a patient comes with arthritis, we look into the causes that what all could be probably causing it. So arthritis means a joint pain is there, joint swelling is there, there's a restriction in the movement of the joints. Mornings you feel a lot of stiffness is there, nights are terrible for these patients, they're not able to sleep all throughout. So when we say arthritis, there are 50 types of different arthritis and every patient can have a different subset of it. So now to come to the broader terms, one is inflammatory arthritis, what we just discussed, and second is osteoarthritis, which is the most common arthritis in the world. You see the patients start having knee pains at the age of 45, 50 when they're climbing down the stairs. So when they go to rest, they're still comfortable, but the moment they start doing some activity, they start having pains. So that category mostly is called as an osteoarthritis. So osteoarthritis normally comes with age after the age of 50, 55. Inflammatory arthritis comes at a very younger age as we discussed. It can be in childhood also, and most common age groups is 20 to 40.
But you don't see that common, right?
We do see now as the specialty is increasing, number of rheumatologists are increasing, so we have started seeing more and more of these cases.
Okay.
And their patients are also a little more aware where to go through. So now osteoarthritis does not have too many medicines. You do more with the exercises, some supportive treatments, and in the end it does end up in surgery if we do not are careful about it for that. The inflammatory arthritis, like we talk about rheumatoid arthritis, can same cause an osteoarthritis at a very early age and in multiple joints. So we have young girls who are like 25, 26, already the knee joint is completely damaged because of this disease. So now at 26, a girl going for a surgery is something, very dreadful. That again at 45, 50, she again may have to go for a revision. So that is where the role of rheumatologist comes in, that he halts the disease right there so it does not damage the joints.
So to understand that case, that girl, is she overweight? And because of what reasons, one could damage the knees?
Yes. So basically like this arthritis which you're saying, the rheumatoid, if we talk, this is one of the most common. So what does happen is it starts attacking the cartilage in the joints. So like what we say is the immune system, you have kept a dog for your protection. So that dog starts attacking you, biting you, and then you have to do some measures to control it. The same goes with our immune system. It is meant to protect us from any viruses, any COVID attacks. The immune system will fight itself. You don't even have to take antibiotics at times and to control it. The immune system takes over and kills the virus themselves.
Okay.
So now in these arthritis, the immune system goes haywire. So instead of normal production, it will start overproducing, and then these are the cells which will damage the cartilage in the joints. So this young girl came to me and she was completely crippled on the wheelchair. She could not walk, both knees were swollen, both elbows, wrist, every joint was swollen. So after starting treatment, we have still managed to revive her, but one of the joint is completely damaged, the left knee. So rest of the things she's able to walk, and everybody in the colony is quite happy to see her that, once who could not take 2 steps is able to do her routine activities. But she was somewhere late in protecting that one joint.
So at this stage, you perform a surgery?
We leave it to the patients to decide if they're able to do out their routine activities. So we can delay the surgery also. And a lot of times with our medicines, we can prevent the surgeries especially in this sort of arthritis patients.
Okay, so there is a provision wherein you can save the patient from not having a surgery.
Yeah.
It can be treated by medicines.
Treated by medicines. So
Okay.
that's where the rheumatologist comes in play.
So, what are the key characteristics in a patient that you see, or what sort of test do you recommend before the patient comes to this department, which is rheumatology?
See, normally test is what our even seniors prefer, that tests are never really diagnostic in our cases. For our, the diagnostic is a good clinical history. That's why most of the time we spend 15-20 minutes per patient to get an exact history of how the sequence of events unrolled, what at the time they experience the pain, and the clinical examination. So, after COVID and the vaccines, we find a lot of antibodies, these tests which we have, are coming out false positive. False positive meaning you can just have a high titer of the test, but you do not have any symptoms. So you don't treat the patient that time. So when the patient comes to us, there's a lot of concept of teleconsult. We always prefer that first time at least visit us so we can get a good history, do a proper clinical examinations, and at least before the patient leaves the room, we should have some 80% diagnosis in mind.
Can I request you to please elaborate what is clinical examination? Does it include some test or just
This
verbal
is what
discussion?
basically a doctor examines a patient. Say like you have a joint pain here.
Yeah.
So this will check if there is an inflammation or it is some form of other things, which you normally get a full idea by checking the joints only.
Okay.
You may be having a tennis elbow or you're having a pain in the elbow. So we need to distinguish if it is tennis elbow, golfer's elbow, or it is an arthritis pain. So that is like a clinical examination, which basically holds the key.
I've never heard golfers
Yeah.
elbow. I've heard tennis elbow, but I'm hearing it for the first time. So why don't you tell us what is the difference between tennis elbow and
So tennis
golfer's elbow?
is basically named after the sports which people do get injured in.
Yeah.
So tennis elbow normally is a little on the outer side, basically here, and the golfers is basically from the inner side.
But is it in the joint or it's in the muscle?
That's outside the joint. So basically, it's in the tendons. So tendons are like the threads which connect the joint to the muscle.
Mm-hmm.
So they get inflamed when we do some wrong postures, basically, or overuse of it. And that is where you have to distinguish, because if it is a tendonitis, a tendon inflammation, you don't need to put patients on very strong medicines.
So basically, coming back to my point, the rheumatology department doesn't go through the entire history of getting the X-ray done and the MRIs done.
See, then it does depend. Like if we say a patient of our back pain has come through, which is one of the most common musculoskeletal problem. So again, the back pain is we divide into two types. It could be a disc pain, which is every person almost goes through that. And then there are some arthritis pains also, which affects the back. If you saw this young kid, tall kid who was coming to me, he had that inflammatory back pain which was going through. So inflammatory back pain, again, the patient will have very difficult time in the nights. He'll not be able to turn positions or sleep properly. Mornings will be very stiff when he wakes up. So this is how we have to distinguish from history. See, because if you advise MRI for every patient, even you and me, we will get it done, we'll definitely some abnormalities will come through. Because MRI sees things microscopically, you may not even have symptoms of it.
Okay.
So we have to be, that's why we say it's a preclinical advice, which is most important. And why exactly are you advising the test for the patient?
I have another question wherein, I was just trying to read through and research. So there was a question that I saw on the internet that says that there are a lot of misconceptions about rheumatology. Can you tell them what sort of misconceptions that are there?
See, first thing, a lot of misconceptions are there because patients think that diseases are not treatable. So that is the main thing. We are also agree that these are not a curable disease, they're like controllable diseases. Like diabetes, thyroid, blood pressure, these are similar form of diseases.
And you can't just cure it completely.
We can't cure it completely. But over time, what we have seen over practice, that once you catch the disease early disease means within 6 months. So you are able to at least reduce the medicines of the patients, and then they slowly come down on the minimum possible medicines also. So now we always tell them if it's not curable, at least it's controllable, and if it's controllable with single medicine also, you're still quite lucky. As I told you the case, if it damages the joints, so that is not a life you want to live with, for the next 30 years, 40 years till you're alive.
Correct.
So always a lot of people go to alternative therapies that yes, they have said they're going to completely cure it, but that hardly ever happens.
Okay.
And we lose out on a lot of crucial time which we have.
So this is the biggest misconception.
Yeah. So a lot of times I visited like rural areas also for consultations. So a lot of times we find patients who have already delayed the treatment by 2 years. And one of the other joint is almost affected, and that is where we lose half the battle there.
So, I've also seen, Dr. Naval, that, a lot of doctors these days, after a point, they start prescribing steroids in their medicine. So,
Yeah.
is that the case here also?
So this was the second misconception I was telling.
Okay.
Because a lot of people feel they look rheumatology wale steroids and painkillers se treat karenge, but that is completely not the case now. Steroids and painkillers, we only use it very initially when there is a lot of inflammation, patient is in a lot of pain, and the other medicines, which are the main drugs, which we call it disease modifying agents, they take a little time to act. So we only give it for a brief 1 or 2 weeks period, and that is where we stop it also. We normally use it when the disease flares up suddenly, that he's been doing well, suddenly one joint is swollen. So that is the only cases which we use very acutely. None of my patients are taking steroids or anything for rheumatoid arthritis.
Let me also take this opportunity since I'm sitting with a doctor. So I want to learn or understand from you what exactly is steroid, because as a layman we all have our own definitions of steroid and how it can harm you. But since I'm sitting with the doctor, I would like to understand from you what is the definition of steroid and what impact does it do on your body.
See, steroids are the hormones basically. Like your body also produces steroids. It's the main stress hormone. So once your steroid hormone from the body production goes down, you'll find a lot of times when the stress comes through, you'll not be able to cope up with it. The fatigue comes in, sugar goes down, and other things happen. That happens in certain cases. The external steroid which we are giving is like a replica of it. So it is prepared to basically halt all your immune system process. So steroids are still the best drugs if you ask. When it was discovered in 1950 in arthritis, they gave it by mischance only to a lady. And suddenly the next day she was able to walk. She was almost crippled into the bed.
Okay.
But she had some drug reaction, so they gave it immediately for that. And that's when they discovered, yes, it could work in arthritis also. It is still used in asthma. Even if you ask the COVID wave, which came in 21, steroids were the only drugs which were able to still revive a lot of patients. In a lot of allergies, it is still drugs.
Yeah.
So they're still the best drugs, but because of the side effects, they're not given for very long. So we try to cut down on the dosing as quickly as we can. Some cases we do use longer when the patient's kidneys or the other major organs get hit, but otherwise we try to remove it within 3-4 weeks. So they are like hormones which are synthetically produced outside our body to help control your immune system inflammation.
So, but what exactly happens? Let's understand the side effect. I know the hormones that we're talking about. So, if we start taking steroids, the auto process inside our body stops, right?
Yeah.
That's one of the main side effects.
No, that is like in immune system, you have to stop it.
Yeah.
So that's the main effect. Side effects come because of the other things basically. It weakens your immunity a little. So infection risk increases, then diabetes can kick in with it if you lose it for very long. Blood pressure, some people have it, some people develop cataract with it. So this is when you go on a very high dose, is uncontrolled, you're not monitoring by a physician and you're constantly taking yourself for more than 6 months, 9 months, then these problems tend to kick in.
Okay. You were also saying that if it can be caught early on, so there are chances that the recovery phase is a little faster.
Yeah.
So what are the signs one patient could have to be able to understand that they're going through something which should be prescribed to a rheumatology?
So, like different disease, I'll just quickly touch bases on those. So rheumatoid arthritis, when it starts, it's basically pain and stiffness in the hand joints, especially the small joints of our hands which get affected. Mornings, there'll be a lot of stiffness for 35, 40 minutes, 50 minutes. You may not be able to even form the fist. Night times also the pain gets disturbed. A lot of times you start developing tingling numbness in the hands. At times, this is basically an early symptoms or start of rheumatoid arthritis. We go to a disease called ankylosing spondylitis. So that can have a different, like the back pain which we discussed. Typically night times back pains and the mornings are very stiff. At 3 o'clock, 4 o'clock, you'll find very difficult in turning the positions. So this is the start of this other disease called ankylosing spondylitis.
Okay.
This disease is still a little slower than rheumatoid, but still you have to catch it early before it starts picking up its pace, because majorly it can damage the hip joints when it starts to aggressively increase. Now, third disease we'll talk about is lupus. Lupus is one of the most dreaded disease in medical history still. So a lot of people just have vague symptoms like multiple mouth ulcers, excessive hair fall starts. Sometimes you get this butterfly rash, and then rashes over the arms and this thing, vague joint pains. It does not give you swellings in the joints, but you'll have like typical symptoms of rheumatoid, morning stiffness, mouth dryness, eye dryness. So these are very vague symptoms. But if uncontrolled, it can lead to damage on any organ in the body. So this is one disease from head to toe. It can affect any organ. And recently, if you heard about this female who had dermatomyositis, the Dangal superstar. So that is again a part of rheumatology only, where patients will start having rashes over and then slowly the muscle weakness starts through. And then it can even damage your lungs and other organs. So all the disease, if you see, they're very aggressive, some of them, especially lupus, this dermatomyositis. So if you catch them early, it's always best to hold them very tight there. Because now there are good medicines available, good drugs available. So without steroids, with the painkillers, you can do still good with them.
So you're saying primarily it's all the joint pains, initial or early on. But how can a patient basically identify between a joint pain and a muscle pain?
See, that's something that eventually, joint pains, due to, again, it can be because of overstrain also. And joint pains can be because of inflammation also. So overstrained joint pains are normally when they do some activity, and same goes with muscle also. If you're resting in through, then the muscles are quite rested. That time they may not cause pain. But if you tend to do some activity, say you have some strain in this elbow, you're trying to open the door, open the tap, you may start having pain, but when you're resting, it's quite okay.
Yeah.
So that is one of the key factors. Like any pain on rest is mainly with arthritis. Any pain on movement is mainly with either a muscle sprain or other things.
Okay, sure. How does the lifestyle and the current eating habits that we have in all urban cities is impacting the rheumatology?
I think it's not just with rheumatology. I think with all the diseases, if you ask us, diabetes, India is the capital now. Cancers are all-time high. So there's a definitely link to a lot of our food habits, the sedentary lifestyle. A lot of smoking is one thing which has increased recently. Even in a lot of our females, which we see, the smoking has definitely gone up quite a lot in the last few years. So now with rheumatology perspective, we always tell patients to avoid eating a lot of processed foods, preservatives, and red meats and other things which we tend to avoid.
Okay.
That is one risk which has been found to be highestly, which can trigger the arthritis. Smoking definitely has one of the biggest triggers. It can even increase the speed of arthritis by 5 to 6 times. So these two things we definitely ask to avoid. Outside food, we always say if you're eating, it should be well cooked, well heated. Because a lot of times stomach infections which we get can trigger the arthritis, which is maybe dormant underlying. And sedentary lifestyle is something which we have to avoid. Because that's why we say 30 minutes of daily exercise, 5 days a week is still good enough to go through. Prolonged sitting will just add up to more problems in the neck, the lower back. The weight will start increasing. And once the weight starts increasing, your knees will start crumbling. So what phenomena we saw at about, if you ask our grandfathers, Dadaji, what they used to have at 65, 70, we started seeing in OPD at around 40, 45 basically. And by 50, a lot of them end up in joint.
What are we talking about here? I mean, what sort of symptoms?
See, again, it will be knee pain on some exertion, back pains. So, and once the changes start, वो कहते हैं भगवान के दिए joints अच्छे होते हैं. Once ever the changes start, especially in the neck and the back, you cannot reverse them back to the normal then. So that's why the ergonomics, the postures, all has to be very, robust in these things.
Sure. I was also reading when I was doing my research. I was also reading that it's more to do with muscles. A rheumatology doctor is not basically an orthopedic doctor, but they're more to do with muscles. Is that correct?
See, again, muscle disease, if we ask, there are two types. Again, it can be overuse of the muscles, the strain, or a degeneration. And then there are the inflammatory disorders, like which we discussed about the dermatomyositis right now. Samantha Prabhu, she had a polymyositis, which is again a muscle disease only.
Okay.
So when the muscles are inflamed, those are more like a threatening diseases, which has to be caught very early. Because muscle damage takes much longer time to recover than the joint damage. So if a joint is inflamed, it will still go back very fast. But if a muscle gets damaged by these diseases of rheumatology, then the recovery time gets very long, to 6 months to 12 months also.
So do patients like who have, let's say, ligament tear, frozen shoulders, tendon tear, do they come to you?
So tears normally, like, they just come to us for the pains basically, then we do some investigations like an ultrasound of the joints or an MRIs depending on that, and if the grade tear is high, then we definitely refer them to orthopedicians for the repair part basically.
Okay.
So that is where the role of our orthopedics colleagues come in play.
So how about the sports fraternity, or let's say a sports player or an athlete? Uh, do they have a chance of developing rheumatology? I mean,
See,
this disease
rheumatology is something which you, me, or anybody in the world at
can
least has
have.
a 1% chance of developing any time in the lifetime.
Mhm.
Because rheumatological disorders can be triggered by any simple infection also. You can have a small H1N1, it may start off your arthritis. If you saw the chikungunya arthritis which was going through the virus, a lot of people started developing joint pains after the endoviruses. So
Mhm.
rheumatology is something which can get triggered by anything. Or the sports players go through this lot of the other disease which you were talking, the osteoarthritis, because there's a lot of ligament wear and tear, especially in the knees and the hips. And then definitely depends on the profession. Boxers may have more of this thumb osteoarthritis because it keeps getting hit. And any cricketer definitely develops more of the knee problems a little early, especially the fast bowlers when they go through the strain they have to take through. Tennis elbow is very common in our a lot of cricketers.
Batsmen.
The golf people either develop golfers, or a lot of them have shoulder tears. So it all depends on the profession. So they definitely are more prone to injuries compared to the other people.